My name is Maria Grominski, and I'm a palliative care social worker at a Valerie Fund Children's Center for Cancer and Blood Disorders. I want to share a little bit about what palliative care social work means, who palliative care social workers are, and how I support Valerie Fund patients during their treatment at the Unterberg Children's Hospital at Monmouth Medical Center. Pediatric palliative care is specialized medical care for children living with serious or chronic illness. It focuses on providing relief from the symptoms and the stress of the illness. The goal is to improve quality of life for both the patient and the family. Palliative care is provided by a specially trained team who work together with the primary treatment teams to provide an extra layer of support. A primary treatment team, such as the Valerie Center, can refer a patient at any age or stage of a serious or chronic illness. This type of care can be provided along with curative treatment and is not based on the patient's prognosis. Palliative care focuses on quality of life. It adds life to yours, not yours to life. It helps patients carry on with daily life and improves the ability to go through medical treatments and live life to the fullest. Pediatric palliative care social work is a subspecialty of social work. I work closely with social workers on the primary treatment teams as we both provide a different service and have different expertise. As a palliative care social worker, I pride myself in building relationships with patients and families. When patients are able to share their hopes and fears, I am better able to understand how I can help them as a palliative care social worker through their treatment. I am also able to communicate this information to the palliative care team as well as the primary treatment team so we can all work together to best care for the patient. This is extremely helpful during family meetings when the teams are working on clarifying treatment goals and doing advanced care planning so families can make the best decisions for their child. When a patient is diagnosed with a chronic or serious illness, there are so many losses the family faces. During the immediate diagnosis, families worry about a loss of income, loss of family time together, and the loss for the child not being able to go to school. Families also worry about the future that they had dreamed of since the child was small, such as important milestones of going to prom, graduating from college, and having children. As a palliative care social worker, I am able to provide counseling to patients to give family an outlet to express their sadness, worry, and hopes. Sometimes in the continuum of palliative care is end of life. If cure is no longer possible, the palliative care team helps a family transition to this new phase of comfort and decisions. Palliative care social workers have specialized training in bereavement to help parents and siblings cope with the loss of a child. Through the Valerie Center, we can offer ongoing bereavement services. In addition to palliative care, I would also like to give you information about the Integrative Medicine program at the Valerie Fund. This program also offers extra services to patients and their families, as the medication used to treat serious illnesses can often cause discomfort. These non-invasive, personalized therapies help our patients with side effects, including pain, nausea, bone and muscle aches, anxiety, and stress. This method incorporates an individual's physical, emotional, spiritual, and social well-being. Some of the therapies used by trained professionals are acupuncture, acupressure, aromatherapy, massage, Reiki, and other non-invasive healing techniques.